Morning. Thanks for all you guys for coming out on Saturday. And so I'm going to talk a little bit about orthopedic surgery and medicine and talk a little bit about total knee replacement and show you a video. So by the end of the talk today, all you guys will know how to replace a knee. So who knows what orthopedic surgery is? Anybody? Any guesses? What part of the body do we treat? Legs. What else? Arms. What else? Hands. Yeah. No, we don't treat eyeballs. That's ophthalmology. So orthopedic surgeons, we're surgeons, so that means we get to cut on people. That's the fun part. And we care for the musculoskeletal system. And that's basically just a fancy way of saying we treat the muscles, bones, and joints. So we do arms and legs, spine, don't do much around the head, we don't do the heart, lungs, and all that stuff. And so, we treat bones and joints. So if you break your bone or if you tear a ligament, all the athletes you hear about having sports medicine problems, that's all orthopedic surgery. And within orthopedics, there are lots of different areas that you can specialize in. There are 8 different areas. And so one of them is trauma. And those are the folks who, like at Bentab or Memorial Hermann, at the trauma centers, they fix broken bones. So if you're in a big car wreck and you break your arms and your legs and your pelvis and all that, that's what the trauma surgeons do. And you can see on the x-rays here, that's where we put metal plates and screws in to fix the bones. Another specialty is hand. There's some of my partners are just hand surgeons, so they just operate on the hands and fingers and treat problems in the upper extremity. What I do is total joint replacement. So I replace hips and knees, and we'll talk about that a little bit more, but I treat typically older patients, grandparent age, who have arthritis in their joints. And so replace their joints and get them pain-free and back up and walking and moving. Within orthopedic surgery, you can do all sorts of different things. You can treat kids, you can treat old people, you can do big surgeries, or you can do little microscopic surgeries. So it's a fun area. So how do you get to become an orthopedic surgeon? So you guys know what it takes to become a doctor? Well, it takes a little while. So after high school, you got to go to college. And it takes about 4 years of college. And in college, you can major in whatever you want to major in. You can be a history major, an art major, a music major, or you can be a biology major or chemistry major, or whatever you want to do, as long as you take the basic requirements to get into medical school, which are a few science classes. For example, I was an engineer. My background is in biomedical engineering and material science and engineering. And then I decided to go to med school. So medical school is then another 4 years, and that's where you learn to be a doctor. And so during medical school, during the first 2 years, you pretty much are doing sort of the same stuff that you did in college. You're taking a lot of what we call basic science classes. So you're learning about DNA and all the stuff you guys already know about now. You're doing biochemistry, physiology, and just learning the basics. And then the second 2 years of med school, you get to actually go into the hospital and actually start taking care of patients. And that's the fun part of medicine. Then after medical school, that's when you're a doctor. So you have an MD degree. But you're just a doctor, you don't know what you're doing. You just learned the basics. And so then after that, you learn to become a specialist in whatever area of medicine you're going to look at, whatever kind of doctor you want to be. So how many different medical specialties are there? Yeah. I don't know. It's a lot. But, so who can name some medical specialties? What kinds of doctors are there?
Pediatrician, neurologist.
Pediatrician, neurologist,
Cardiologist.
cardiologist. What kind? What? Football doctor? That's a sports medicine doctor. Yeah. Any other? Yeah, gastroenterologist. There's surgeons, there's OBGYNs, all of those. So That's what you do during your residency. You decide what kind of doctor you want to be, and you go learn how to be that type of doctor during your residency. So for me, I went into orthopedic surgery. So the residency for orthopedic surgery is 5 years. And so during that 5 years, that's where you're a doctor, you're taking care of patients, and you're learning your subspecialty. So during that 5 years, I did orthopedic surgery. And so then, after that, I decided I wanted to go on even further and to specialize and become a subspecialist. And within orthopedic surgery, those are those 8 areas that we talked about earlier: trauma, sports, tumors, pediatrics, all of those things. So I did a fellowship. A fellowship is where you become a subspecialist. So you're not just an orthopedic surgeon doing a little bit of everything. I became a total joint surgeon, or adult reconstructive surgeon. So all I do in my practice is hip and knee replacements. And so I spent a year of additional training just doing that to become an expert in that area. What we'll do now is I'm going to talk to you about what I actually do. And I treat arthritis. So who knows what arthritis is? What's arthritis?
Joint pain.
Yeah. Joint pain is one of the symptoms of arthritis. Any other definitions for arthritis?
Is it where you lose your cartilage in
Yeah.
your joint?
Exactly.
Starts rubbing together?
Arthritis is the loss of cartilage in a joint. So first of all, let's go back to the vocabulary. So what's a joint? It's where 2 bones come together. You know, like in your finger, you got a bunch of joints. That's what lets you move and be flexible. And so what's cartilage?
The material that cushions the 2 bones.
Yeah, it's the cushioning. It's sort of that white, shiny stuff. Who's eaten a chicken bone, piece of chicken before? Anybody? So, you seen that white, shiny stuff at the end of the bone? That's the cartilage. And the purpose of cartilage is to help your joints move smoothly. That's why you can bend your fingers and your knees and your hips, and you don't have to work too hard to move them. And their cartilage has a very, 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 very low coefficient of friction. So it's very slippery and slick. It's actually even slicker than ice. So that's why your joints can move smoothly without any significant pressure. But what happens with arthritis is the cartilage wears out. And so then you have bone rubbing on bone. And so instead of having nice smooth motion, your joints stiffen up and the bone rubbing on bone hurts. And it causes the joint pain. And that's arthritis. But we know that in the joints, you have cartilage over the ends of the bone. So this is an x-ray of knees. So this is somebody who's standing facing that way. And here's the right knee, here's the left knee. And you can see there's a space there. And on the x-ray, cartilage shows up as a space. Because it's a soft tissue, it's not hard like bone, it doesn't have calcium. And arthritis, again, is the loss of cartilage. So on x-ray, it's the loss of space. So you can see there normally, in a normal knee, there should be about that much space going all the way across both sides of the joint. And you can see here, it's bone touching bone. So that patient has bad arthritis, and so you'd expect their knees to hurt. What I'm going to do is talk to you about what is a total joint replacement. Total joint replacement, what we do is we shave off that arthritic bone-on-bone surface where the cartilage used to be, and we resurface the joint with metal and plastic. So who here has seen road construction when they're repaving a road? Yep. So you guys have all seen that. So you know when they're repaving the road, you got that bumpy surface. So that's like an arthritic joint. So what do? They take the big scraper and they shave off the rough stuff, and then they put down a nice smooth layer so your car runs smoothly. That's all we do in surgery. It's just repaving, resurfacing the joint. And that allows the return of pain-free motion. So I've got some examples over here for what joint replacements look like. They're metal and plastic. So Here's an example. So this is a metal part that goes over the end of the thigh bone, over the end of the femur. And this is a tibial tray over the shin. So that goes on top of the shin, and then the metal with the plastic liner in the middle, and the metal sits there. So that's how your knee bends back and forth. So pass these around, you guys can look at them. Pretty heavy. Yep, it helps the knee. And here's,
So you cut a leg open so it can move?
yep, I'm going to show you a movie in a second, so you'll know how to do it. That way you can see him do it when you get home.
Wait, no.
Here's an example. This is a model of a knee. So this is, so here's the thigh bone, here's the shin. And so pop it open here. So here's the metal cap. We just cut the bone to match that end surface. And we do the same thing on top of the shin. We just shave off the top and put the metal implant in there. You guys can look at that one.
How long does that surgery take?
About an hour,
How long is the recovery from that?
about a year. Most people are significantly better within 6 to 12 weeks, but yeah, I tell everybody it takes a year to be 100%. I'm going to zip through this, and this is a very fast video. It's sped up. Dr. Nelson's a fast surgeon, but he's not quite this fast. And we'll go through here. Oops. Okay, so here, he's opening the skin. Right now he's coming down through the skin, over the kneecap. Kind of hard to see, the kneecap gets blurred out a little bit. So now he's cutting right around the edge of the kneecap there. So this is on the inside of the knee. You can see a little bit of the thigh muscle up there that he's working under.
Why wasn't there any blood?
So now he's opening up the joint. There's a tourniquet on the thigh. It's like a big blood pressure cuff that's squeezing to keep the blood free, so we can see what we're doing. So he's opening up the joint and just taking some of the tissues and taking them off the bone so we can see what we're doing. Biting off some of the bone spurs there.
What actually causes a bone spur? Just the pressure against each other?
Yeah, the bone spurs, when you lose the cartilage, the bone grows in response to the overload and the lack of cushioning.
You
So
see the
this is taking
smoke
out
coming
just some
out of it?
fatty tissue out of the knee. It's called a fat pad. It lives behind your kneecap. So what he's doing here is, this is our cutting guide. He's putting this along the shin, and this is the little block that he'll put the saw through to help cut the resurface off of the top of the shin or the tibia. So he's got that lined up, so you can see there's the saw. So cut the bone. He's just taking off that top surface.
Is that a real person?
Yeah, it's a real surgery. So now this is he's checking the alignment to make sure that he cut the bone straight. Now he's up on the thigh, so that's going into the inside of the thigh. So that's the guide that's going to help make sure we cut the end of